Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hey listeners, it's Lindsay Smith-Rogers. Today, a look at Be More for Healthy Babies, a Baltimore City Health program that just celebrated its 15th anniversary. What started out as an initiative to reduce infant mortality rates, especially among Black children who were dying at very high rates compared to their white counterparts, has grown into a program that cares for people across their lifespans. Stephanie Desmon is joined by Johns Hopkins Bloomberg School of Public Health Vice Dean Dr. Josh Sharfstein, Assistant City Health Commissioner Rebecca Dineen, and Stacey Stephens, who works on the program in some of the city neighborhoods. Let's listen.
Josh Sharfstein, Rebecca Dineen, and Stacey Stephens, thanks so much for joining me.
Thanks for having us, Stephanie.
So today we're here to talk about a program that just celebrated its 15 years in existence, Be More for Healthy Babies. So I want to start with you, Josh. You were the City Health Commissioner in the mid-2000s, and you identified a problem, and you all brainstormed and came up with a solution. Can you tell me, Josh, what it was like at the time?
Sure. Let me just say that it's great to be here with Rebecca and Stacey. I am so impressed with the work that they've done and everybody listening to this podcast is going to hear about. In the mid-2000s, it wasn't something I identified. It was something that was really a obvious problem for the city. Our infant mortality rate was going up, and there was a staggering racial disparity. I believe at that time that African-American babies were 4 or 5 times more likely to die before age 1 than white babies. So it was stunning. Our rates were particularly high, even given some of the challenges like poverty that exist in Baltimore. And things weren't well organized. There really wasn't an effort to try to save children's lives. So we had to do something, and that's where this whole project started.
So why was the rate so high?
Well, I think it relates to some structural issues that go a long way back in Baltimore, not just poverty, but also tremendous discrimination that had been embedded in policies that left parts of the city without a lot of resources. Infant mortality is often considered to be a reflection of social inequity, and I think that was definitely the case in Baltimore around this time. And there were also problems in accessing critical healthcare services. So it wasn't just one problem. I think there was a foundation that paid people to get together around that time and lay out all of the issues, and it was a long report. There were a lot of different challenges. And so trying to wrap your hands around something that was so deep-rooted and yet so urgent in need of attention was a big problem for us, how to do that. And we started by looking to bring someone to the health department who had had some experience with this and could really be a leader for the city.
And I think that's a perfect lead-in to Rebecca Dineen. You came to work for this new project. Tell me what you saw when you arrived.
Yeah, I want to say that my background is in international health. I worked as a Peace Corps volunteer and then worked with projects with largely USAID for many years in countries that had far fewer resources than what we have here. All of my work was in maternal and child health. So I learned from people who are real experts in public health about how to think about the population as opposed to individuals only. And what I found when I came here and was asked to look at the issue of infant mortality with Dr. Sharfstein and others was that the work that was happening in Baltimore City was very programmatic. So it wasn't a big picture look. We had home visiting programs, we had WIC programs, we had adolescent reproductive health programs, and lots of different funding streams to different community organizations, and it was coming from the state and it was coming from the city, and it was pretty disorganized and really good work happening in each of those areas, but not necessarily combined with a vision. It was really from the findings from lower resource settings where I've worked mostly in Africa and Asia, where you look at how to put together all of the resources that you have into one basket they call it basket of funds, and think about how to address the supply side of services. Like, how do you organize the services that are available to everybody related to maternal and child health? And then the demand side, how do you communicate about what accessing services or what are the data in the city? How do you talk to residents? How do you become scrappy and go door to people and just talk to them about the work? So that sort of thinking and big picture work and ensuring that those programs are that work is done with a high quality framework was something that is done internationally, and I was able to use it and apply it to a domestic setting.
So, spoiler alert, you guys have done amazing work and the infant mortality rate has fallen significantly in Baltimore. Is that correct?
It has, yes. In fact, in 2021, we achieved the lowest ever infant mortality record rate, and there was a 39% reduction in infant mortality, a 41% reduction in sleep-related deaths, and a 57% reduction in teen births. And just to sort of pass it to Stacey Stephens, we actually were able to eliminate the racial disparity in that year in Upton and Druid Heights and Patterson Park North and East, where Stacey Stephens has been doing a ton of work.
Stacey, how do we do this work?
So thank you so much for the question. I want to share that my background is in social work and also public health. And so as a social worker, we have high regard for respecting individuals and social justice and dignity and meeting families where they are and autonomously, allowing them agency to determine their path towards improving their health. Basically, starting this work probably 14 years ago in the community of Upton and Druid Heights out of the University of Maryland School of Social Work and Medicine. Had an opportunity to get to understand and know the inner workings of those two communities, Upton and Druid Heights, and who was living there, multi-generational families, and we were basically place-based. We were located in elementary schools where we believed that we could easily access the individuals who were most impacted by these deleterious outcomes. And so we met moms and dads and grandparents right in their community, in their school, at libraries, faith-based organizations, at their recreation centers, in laundromats, and really got to understand what was happening in their community. What were the joys, what were the strengths, and what were the challenges that they were overcoming every day as they were living and also trying to access health care, and at that time, expectant families accessing prenatal health care. And seeing and understanding and having our office right there, we got to experience many of the challenges that residents were up against. And so those were a variety of things, in communities where there was inadequate housing and inadequate safe and healthy housing, food insecurity, dealing with pollution because you're on bus routes, dealing with high heat, dealing with unsafe air quality. So many factors. But I will always raise that families and communities have been persistent and consistent in being there for each other and supporting each other and identifying resources such as our program and Healthcare Access Maryland and many other groups who allowed folks to access the services that they needed, be it food, mental health services, services with getting healthier housing. That's how we started, and that's the work that we have done. We've focused on building relationships, sustaining those relationships over time.
Rebecca, I understand that one of the big things you did at the beginning was the Back to Sleep campaign. And I'm wondering if you could tell us a little bit about it and what kind of impact it had.
Before Rebecca does that, Stephanie, I want to jump in for a second because I have to give you the preview here. We've been trying to do Back to Sleep campaigns for a while before Rebecca started and Be More for Healthy Babies began. We had done a number of things focused on the hospital. We had trained the nurses in the different newborn nurseries. We had even given every newborn in the city a "If I'm Sleeping, Turn Me Over" onesie. I was writing letters as the health commissioner when babies had died from unsafe sleep, from sudden infant death, saying, hey, there was a baby that came through your nursery. Please use this, terrible tragedy as a way to reiterate to everyone it's really important to do the right thing. And I remember vividly reviewing all this work and just expressing my frustration that the numbers weren't budging to Rebecca, who said, it seems like, I'm kind of paraphrasing here, it seems like you have the healthcare system covered, Josh, but there's a lot more to helping people take care of their children than just the healthcare system. Anyway, that's at least how I remember it, Rebecca.
Rebecca?
Yeah, what we noticed first of all was that everybody calls it's the back to sleep, which is actually now safe to sleep. All babies should sleep alone on their back in a crib, don't smoke. So ABCDs of infant safe sleep, critically important. We derived everything from our child fatality review. So all of the work that we do comes from real cases of sleep-related infant death. And what we noticed first and foremost with the data that our epidemiologists were able to look at was that 95%, maybe even upwards of 99% of our deaths were in situations that were where babies were sleeping unsafely. So there wasn't just sort of a natural, why is the baby dying of SIDS? It was really sleep related. So when we were looking at our infant mortality rate, we were like, the one thing that we can really make a difference about in an infant mortality rate, and particularly disparities, because there generally were to African-American families, if we could prevent these sleep-related infant deaths, that would be amazing. And like Josh said, they were doing a great job at getting the word out to hospitals and to health centers. So we started scratching our heads, and we had the data. We had really good data, are able to look at all the characteristics of what a sleep-related death involves. You know, who was the caregiver? Was there smoke in the household? Was there prenatal smoke? Was there, lots of different factors. So we were able to really create what the story is around these situations. So what we did was we actually had at this point in time already hired a group called Johns Hopkins Center for Communication Programs. We issued a request for proposals and for a communication partner, because what I noticed first and foremost when we wrote our strategy is that there isn't a communication partner, somebody really understands behavioral and social sciences who can do it in a mass way and in a social marketing way, because you can do all the door-to-door, community work you want, and you can do all the health systems work you want, but you want to braid it all together in a campaign. Johns Hopkins Center for Communication Programs won the award. There were other applicants, but what they really brought to the table was this ability globally to create incredible materials and branding around particular issues. And it was all around efficacy. So you use the health and behavioral social sciences to come up with. And they said, well, where did you come up with these ABCs of safe sleep? And I said, well, I think they came from child fatality review. They said, alone back crib, ABCs, that should work. And they said, well, have you talked to the residents so much? And I said, well, no, we haven't really done a lot of that. So we held listening sessions and focus groups with people who'd had sleep-related infant deaths, people who hadn't had sleep-related infant deaths, residents in general, a number of them. And what we found was we brought the materials that had been used into these groups. And in the groups themselves, there were people who had had sleep-related infant deaths. And they said when people heard their stories, because the stories came out through the questions that were asked, everybody looked at them. They're like looking at the blocks and listening to the story. And they said, we want to hear what would make a difference to me is listening to this story. Because we had people who came into the focus groups and they're like, I'm going to put my baby on the belly because, that's just how babies sleep better. And after these groups, when they heard people describe how they'd lost a baby, they said, I will never do that again. So the focus groups themselves became an intervention. We were like, okay, we need to have a video of families, if they're willing, to share their stories. One of the people who shared their video, there were a number of women, just really brave family members, but one was De'Ara Matthews, and she shared her story. And in fact, she's just an incredible person. She's now a doula, not in Maryland anymore, unfortunately, but she became a champion. And all of what was developed in this video that CCP developed, all of the words that were used or the messages, first of all, we used a alone back crib. So it was very clear messaging, but that had already been there, but it was put into the stories. And so each of these families said, and always put your baby alone back in the crib. But then we were able to develop this video, and De'Ara herself, all of her words and expressions became our campaign. So that's what was on the sides of the buses. That was what was made into television, TV ads and PSAs and so forth. But the other big thing was, so we got it out everywhere in traditional marketing techniques. We got the video out in DSS offices, WIC offices, all prenatal care, all pediatric offices, all hospitals, jury duty, I put it up, which we're trying to get them to do our new video and put it in so that no matter where you went, the beauty of this ABCD and why I think our work works so well is it's true for everybody. It's just a lot, everybody should put their baby alone on their back in the crib, don't smoke. So it can resonate with anyone who's having a baby. It's not because you live in Upton Druid Heights, you need to do this, or because you live in Guilford, you need to do this. And these are different neighborhoods in the city. It was that everybody who has a baby, this is what you want to do, and make it clear through a messenger like a Dear and Matthews, who was such an important peer champion, but then also be able to bring it out to everybody in the city. So that video, I think, was an incredibly powerful tool that made a huge difference. And what has happened over time, and I know Stacey will talk about how they worked with barbers and others, and I'll pass it on to her about how they were actually able to make that messaging come really clear in the community. And then I pick it up just on one thing after that. But Stacey should talk because she's done tremendous work in the area of community organizing this.
Before I go to Stacey, I just want full disclosure. My day job is at the Center for Communication Programs. So
Okay.
let me move on to Stacey.
Yeah, so I really appreciate Rebecca sharing the background of the importance of storytelling, because that has always been so critical around changing public health outcomes. And so for us to really continue to move that message forward, we moved it everywhere, no matter where we went. We were looking for folks. As we were sharing safe to sleep information, we were like, grandparents, how does this resonate with you? Teachers, principals, how does this resonate with you? Do you have a family member who's pregnant who has just come home with a baby? You can help us ensure that babies are safe and they can sleep and they can live and thrive beyond their first birthday. And so a part of the work that we do is community outreach and engagement with our social workers and community health workers and home visitors as well. And so we were going door to door one day, reaching out to residents and also business owners. And we came across Cut Styles, which is in West Baltimore. And we met Antoine Dow, who is the owner of that shop. And he had just had a baby who was born prematurely and was in the NICU and was bringing the baby home. And I'd never met Antoine before. And so we just shared the information, showed the video. And he was like, oh my God, I was going to put my baby to sleep on its tummy. That's what they were doing in the NICU. And I was just like, no, this is not what you're supposed to do. And he goes like, you really are saving my baby's life. And I have to go home and share that with my partner. And so from there, it has just grown over the years. Well, the barber shops have invited us in to share information during critical periods of the year. We share during Father's Day and address not only safe information, but also smoking cessation during March Madness. And we share information around improving male mental health during June, which is, I believe, Male Mental Health Month. And following the pandemic, they invited us out every month to be involved in their barbershops, really leading information and information sharing and educational opportunities around issues that they are dealing with as fathers, as they are supporting their children and also supporting each other in improving their health and mental health outcomes. And so that has just grown over time. And we are really grateful that individuals have been able to see themselves in this messaging, identify how important it is, and how it is that they can continue sharing this important message with others.
And Rebecca, Be More for Healthy Babies is now so much more than infant mortality. Tell us a little bit about the scope of the work.
Yeah, I will. I just want to add one more thing about safe sleep that I wanted to share. We went into the jails and we talked a lot about infant safe sleep. And what we found when we asked people, do you know anybody who has had a sleep related death or anything like that? And half the people in central booking were raising their hands. So many people had that experience. And that's the kind of thing that really just shook us. And so we said in central booking on the flat screen, we want to add a flat screen TV and share this video and share other educational materials. So a lot of what Stacey's describing is in the neighborhood level. We're also trying to do at the citywide level, just making sure that any big organizational infrastructure in the city that's touching people, let's start reconnecting people into support and care and reach out to all members of the community, because some of them are in these situations because they've been through so much pain. And so I just wanted to share that. The other thing I wanted to share is that when COVID, Stacey and we were focused on maternal child health, but got lost into, I ran the vaccination campaign. And a lot of our money for marketing and so on had to be shifted. And what you see is the sleep-related infant deaths started creeping back up. And then last year, in 2024, we did a massive amount of provider and community outreach, and we cut it back in half. So I just want to say that it's public health, and public health work is really powerful. But if you take your eye off the ball, that's what happens, especially in a country where everything is focused on really high tertiary medicine. That if you take your eye off the ball of these important things like immunization or infant sleep-related death, you're going to see the consequences of it. So what else are we doing with Be More for Healthy Babies? We have a strategic refresh that's about to come out. Maternal mortality, the leading cause of which is overdose, is a major area of our work with Be More for Healthy Babies. And that'll be launching in July. I think Stacey can talk to this a lot as well because being with the social work background. But when we think about infant mortality, you have to look at the life course. A baby doesn't die because they were preterm or there was something happening in that pregnancy. That can happen, certainly. But most often the case, we have issues of infant mortality in the city because of the life course events that happen from fetus to early childhood, to when a kid goes to school, to when they graduate from high school, if they do graduate, and so forth. So that life course, which has to do with the violence in the neighborhoods, the lack of green space for people to run in, the chronic diseases that may occur, and that's over a lifetime. So the incredible stress that might be due to institutional or, personal racism that happens for women and young people as they're pregnant affects their fetus and can affect the fetus throughout their life course. Works with a framework. We're very intentional about our approach. It's called the social ecological model. We make sure that we look at a person throughout their life course and then their interactions with other people. So we work with their relationships and then with their community. And so we work on many, many different areas comprehensively that all will ultimately impact, we hope, infant and maternal mortality.
I want to piggyback on a little bit of what Rebecca said. So it was really critical, everything that she just said. And a lot of times when we were having conversations about life course and about stressors and about chronic illness and the impact of the built and lived conditions, we were having those conversations around health practitioners and public health providers and social workers. And so just as we did with, really moving that information and messaging around safe sleep into the community, it was extremely important that we shared that in a way that it was relatable and that everyday people could receive it and understand it, because then they can go forward and then make the changes and organize together to make the changes to address many of the upstream factors that Rebecca mentioned. So really addressing, okay, if we're overcrowded, what can we do as a community? If there is a lot of crime, how can we organize and work for better safety and show up and advocate for that, not by ourselves, but collectively? And so they were clear that many of the outcomes were not just tied to behavioral health changes they may not have been able to follow through with, but it was because of those invisible factors that have been happening intergenerationally that they can now say, aha, now I see, now I know, and maybe that alleviates some stress, and then let's learn more about how it is that we can lift and create deeper change.
Josh, would you like the last word?
I just want to say when this all started, Baltimore stood out because of our high infant mortality rates. But it's amazing to see over this period, because of the efforts of Rebecca, Stacey, and so many others in the city, Baltimore stands out for having tackled this challenge in a way that many, many other places haven't. And I've watched as Rebecca and Stacey have given national talks, been invited to do consultations. Baltimore is known for being a city that has effectively, or is effectively, tackling these challenges. And it's really great. It's one of the benefits of being old now, Stephanie, is you get to see that problems are not always problems. Problems can become solutions that you're proud of.
Josh Sharfstein, Stacey Stephens, Rebecca Dineen, thank you all so much for sharing your story.
Thank you.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmon, and Grace Fernandez-Ciceri. Audio production by J.B. Arbogast, Michael Bonfils, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production coordination by Catherine Ricardo. Social media run by Grace Fernandez-Sasiri. Analytics by Elisa Rosen. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.